Good evening and welcome to our fourth and final episode of the Bryan Facebook Live series discussing the COVID-19 vaccine. My name is Lisa Vail. I'm the Vice President of Patient Care Services and Chief Nursing Officer at Bryan Medical Center. It's my privilege to serve as your host this evening to discuss such an important topic for women and families. Tonight we will follow a similar format as our previous episodes. We'll begin with a question and answer discussion with Dr. Meghen Bokemper and then answer questions live. So please feel free to submit your questions in the comments section of the Facebook throughout the broadcast, and we'll answer them a bit later in the show. I would also like to mention that our 3 previous Facebook Live episodes are still available on the Bryan Health Facebook page and the YouTube channel. One quick housekeeping item for the audience. For safety, I want to let you know that we have both been vaccinated and we are maintaining physical distancing. Our fantastic production crew is over 15 feet away and they remain all masked, as is our standard within Bryan. Tonight, our guest will discuss pregnancy and the COVID-19 vaccine. Dr. Meghen Bokemper is an OBGYN at Bryan Women's Care Physicians. Dr. Bokemper is a native of Lincoln and earned her MD at the University of Nebraska Medical Center. She completed her OBGYN residency in Kansas City at the University of Missouri and has been practicing with Bryan Women's Care Physicians since 2018. Dr. Bokemper, welcome, and thank you very much for joining us this evening.
Thank you.
This is a really interesting topic, and I'm personally very interested because I have 2 adult daughters and I hope someday soon to become a grandmother. So I'm really interested in this topic. So this evening we are discussing a topic that is very important to many women and families in our community, and that is the COVID-19 vaccine and how it applies to women who are pregnant, thinking about starting a family, or breastfeeding. Before we jump into specifics, I understand there's something relevant about tonight's topic you would like to share before we begin the broadcast.
Yes. Thank you very much, and thank you for having me this evening. I'm very humbled and honored to be able to discuss this topic. It is especially important to me right now because I recently found out, my husband and I found out that we are expecting our first child. And so I actually had the opportunity to receive the COVID vaccine during my pregnancy.
Well, that is fantastic news. Congratulations to you and your husband on that happy news.
Thank you.
We really appreciate you sharing this information because it's especially timely with our episode tonight. Many of the topics and questions we are going to answer tonight are things you've gone through or will go through in the future. So thank you for sharing. I wanted to start with the same first question we've asked other providers. We feel it's really important to hear firsthand experiences from those who have received the COVID-19 vaccine. What was your experience receiving the vaccine, and how did you feel? And why did you decide to receive the vaccine?
Sure. So I was very fortunate to be able to be offered the vaccine through Bryan back in December. As a surprise, we had actually found out that we were expecting a few weeks before the invitation for the vaccine came. And so honestly, I was a mix of emotions. I was feeling almost everything. I was relieved and excited at the opportunity to get the vaccine because it seemed like hope and it seemed like a light, at the end of this tunnel that we have been just grudging through this past year in 2020. At the same time, though, I'll admit, as a going-to-be new mom, I was nervous. I was incredibly nervous. This is a brand new vaccine that is out, and I think that was scary. And I feel like I was completely on that patient side of things where my number one thing was I didn't want to do anything that would hurt my baby. That was a legitimate fear that I had. Ultimately, after reading the research, seeing the medical data, reading about the design of the vaccines and how they were made and everything, I felt very comfortable. I felt very much at peace with getting the vaccine. And so I signed up, and I did. I received my first dose in December, and honestly, I did not feel bad. My arm was a little bit sore. And then I received my second dose in January. After my second dose, I will admit I didn't feel super awesome for about 24 hours after that, but from there I was fine.
Excellent. I'm glad that you didn't have any negative consequences or side effects of the vaccine.
Yes.
As we've discussed in the previous episodes, there are certain members of our community who are at a higher risk of becoming seriously ill with COVID-19 disease. What data have you seen in this area when it comes to women who are pregnant or who are looking to become pregnant?
Yes. Pregnancy in and of itself, we've learned a lot over this last year. Pregnancy in and of itself is a risk factor for severe complications of a COVID-19 infection. Unfortunately, it puts women at increased risk of being admitted to the ICU, mechanical ventilation, being intubated, sometimes even ECMO, we have data on that, and unfortunately even death from these serious COVID infections. We're still learning a lot, I will tell you, but the main concern, obviously we worry about the mom getting oxygen when they're so sick, and then the mom is also supporting another little life, and what is that doing to a baby when the mom is so compromised and so ill? So again, I think bottom line is, a lot of people just get very mild symptoms, but pregnancy is a risk factor for severe disease and more complications.
Thank you for that. So as a practicing OBGYN, I'm sure you've had many conversations with your patients regarding this vaccine. What advice and information are you sharing with them so that they can make the decision whether they choose to get the vaccine or not?
Sure. I get asked this question all the time. Very popular conversation subject right now. Honestly, all of the guidelines that I would share with them come from the American College of OBGYN, the Society for Maternal Fetal Medicine, and the American Reproductive Society. Basically, the general consensus is that these vaccines should not be withheld from pregnant women, women who are trying to conceive, or women who are breastfeeding. And I think that's a very strong recommendation coming from all of those societies.
Very good. Thank you for that. Right now, there are 3 COVID-19 vaccines approved for emergency use authorization. 2 of those vaccines, Pfizer and Moderna, are what we call mRNA vaccines. Can you tell us how mRNA vaccines work and a little bit about their efficacy?
Sure. So the mRNA vaccines, I think we've heard a lot about them. Recently in the news, it was a bit newer technology, but it has been around for a while. The bottom line is, in pregnancy, both these vaccines and then the new Johnson & Johnson vaccine, in pregnancy, live virus vaccines are contraindicated. So for example, the measles vaccine or the chickenpox vaccine we do not do in pregnancy. These vaccines are not that. And so I think that's a very important piece of it from our side when we're talking about pregnancy. The mRNA causes your body or signals your body to produce an immune response and produce antibodies against the spike protein on the COVID-19 virus. And so that is its primary efficacy, just forming that immune response, and very effective. You hear the numbers, 94, 95% effective for these vaccines, which is amazing, absolutely amazing.
How long after receiving the second dose of those vaccines, because those are both 2 vaccine series, does one reach full immunity or coverage?
Immunity,
potential
yes. The Pfizer is a 3-week separated dose, and the Moderna is a 4-week separated dose. And so most of the data is pointing to about 2 weeks or so after you receive your second dose, you should be good to go.
All right. Excellent. Great. Well, the third vaccine that you mentioned that was approved for emergency use authorization a couple weeks ago is the Johnson & Johnson vaccine. Can you describe what type of vaccine that is and how it's different than the Pfizer and Moderna options?
Yes. The Johnson & Johnson vaccine is a single-dose vaccine versus the Moderna and Pfizer, which are 2 doses, so that is a nice piece of it there. Its design is slightly different. It is something called an adenoviral vector instead of strictly the mRNA. Again, no live virus in this vaccine. It is the same concept where it will signal your body to produce that immune response, produce those antibodies kind of directed at that spike protein there. I will tell you specifically in relation to pregnancy, Johnson & Johnson also did make a vaccine against the Ebola virus using this same technology a few years back when Ebola was kind of on the forefront of the viruses that we were concerned about. And that vaccine has been safely given to pregnant women, and so that's very positive that, you know, it's a similar design.
Very good. You spoke a few moments ago about pregnancy being a risk for COVID. So what are the statistics and the data that you've seen related to women who are pregnant looking to start a family or breastfeeding after having received the vaccine? So are there any studies out there that you would like to mention more about?
Sure. So at the beginning, when the vaccines were so new, back in December, you know, in January, we didn't have randomized controlled trials that included pregnant women or breastfeeding women. It's unfortunate, it makes our job, you know, a little bit more difficult with counseling patients, but I understand, you know, where people are coming from. Pregnant women, breastfeeding women, children are usually kind of excluded from those initial trials. But now, you know, a few months later, we have actually vaccine registries, which is great, like the VSafe registry. And there have been thousands of pregnant women that have been vaccinated. I think most recently I looked at about 30,000, probably a lot more now, that have recorded that they have received the vaccine, recorded side effects, and then as well for us recorded pregnancy outcomes. And so this is a huge, absolutely huge resource. We have rates of miscarriage, we have rates of stillbirth, you know, we have those unfortunate kind of pregnancy outcomes that are recorded in these people that have had the vaccines. Great news is that honestly, the bottom line is we are not seeing that these adverse kind of pregnancy outcomes are increased or associated with the vaccine at all. And so I think we'll collect more data as time goes on, but this is very, very favorable.
That is exciting that there is no negative there any more than in the general public for those who haven't received the vaccine. Yes, thank you.
Yes.
There's a lot of material out there that's not true about the vaccine, especially on social media.
Yes.
So what are some of the common misconceptions you've heard about or seen when it comes to pregnancy and the vaccine? Sure. And can you debunk any of those mistaken beliefs for us tonight?
Yes, I think probably the biggest one that I have heard is that if I get vaccinated, will that increase my risk of miscarriage or infertility in the future? That was something that was circulating in the media for a while. I will tell you that it is not true. That is not a true claim. We have disproven that, one, from the vaccine registry data, but as well, you know, the American Reproductive Society really has completely debunked that and said that there's no association. There's no way that that could happen because the vaccines do not actually alter people's DNA, which is good. And so genetically, we're not modifying anything. We're not changing that risk. And so I think would hope, you know, people look at that research and they say, oh, it's not necessarily true. So, yes.
Great, thank you. We now have 3 vaccines approved for emergency use. It feels like we might be getting to the other side of this COVID-19 virus, and there's light at the end of the tunnel. Yes. How do you see this pandemic playing out for the rest of 2021?
I think a huge goal will be mass producing these vaccines, you know, making them available to everybody in the population. As the vaccines roll out and as more and more people receive it, hopefully we will approach kind of that herd immunity. Yeah, I think we're in a much better place than where we were a year ago. And so we still have a long way to go, and I don't know if COVID-19 will go anywhere fast, but I think, you know, that will be kind of the goal. But from the pregnancy side of it, you know, seeing people feel a little bit more comfortable about being pregnant, feeling more comfortable about grandparents going around their new baby who have been vaccinated and everything. I think it gives us hope.
Very good. And hope is what we need at this point in time.
Yes,
so thank
we
you. We all know COVID has really changed how we live our lives this past year. It's restricted us from seeing the family and friends that we love. And when it comes to being pregnant or thinking about starting a family, that's one of the best parts about that, is to experience that with family and friends. So the vaccine is going to help us reclaim those wonderful experiences, I am sure. So my last question is pretty simple. Do you recommend the COVID-19 vaccine to women who are pregnant, thinking about starting a family, or breastfeeding?
Yes, strongly recommend. And I'll be honest, I wouldn't recommend anything to my patients that I wouldn't do myself. And so hopefully that gives them that little vote of confidence there as well.
Great, thank you very much for sharing that. I appreciate it, Dr. Bokemper. Throughout our broadcast, we've had some questions submitted on Facebook Live. So let's take a few more minutes to get to some of those right now. The first question is there a specific time during the pregnancy when it is recommended to get the COVID-19 vaccine, or is any time safe?
Anytime. Any trimester that you are in, honestly, anytime. If you are offered the vaccine and you have that opportunity, I would say go for it.
All right. So that answers really our next question about, is it safe during the first trimester or so?
Yes. I will honestly tell you, I even received mine in the first trimester as well. And yes, it's been shown that there's no problem what trimester that you get this vaccine.
All right. We have 3 vaccines out there. One of the questions is one vaccine safer than others for pregnant women?
Not that we know of right now. All of them are being promoted again by the Society for OBGYN and the High Risk OB Society. And so I would encourage you to get whatever vaccine is available to you.
Okay, great, thank you. Another question. I'm currently in my 2nd trimester. I feel there just isn't enough data on this. Should I wait until late 3rd trimester where baby is fully developed, or just growing?
It's a difficult question. Obviously, fetal development happens all the way from, that initial conception up until delivery. I would encourage you to get the vaccine whenever you are comfortable. I don't see a problem with it in the 2nd trimester, but again, I would want my patients to feel comfortable with that decision.
Very good, thank you. The next question, is it safe to get the vaccine while breastfeeding?
Yes, I would encourage you as well to get the vaccine while breastfeeding. There's a couple specific things there. We know that breast milk has antibodies in it, and those antibodies are usually passed to the infant. I will tell you, we're still collecting data on how much immune response, can be passed through the breast milk there. But the other thing is, breastfeeding is a very intimate experience, and when you are feeding a newborn, obviously newborns can't wear masks, and so it really prevents the mom from getting infected. And then unfortunately, those respiratory secretions and things, it's a pretty high risk of an infant becoming infected if they are breastfeeding. And so it would really protect kind of secondarily there.
All right, great. You may have answered this in your response, but if you get the vaccine while nursing, does it benefit the baby at all? So.
Yes. Overall, yes.
Breast milk is always good.
It is.
Right?
It very much is.
How might the vaccine impact those going through infertility treatment, IVF specifically?
This is a very good question. And there is actually recommendations that are put out by the infertility specialists, basically. Their thought is you are able to get the vaccine, and they would encourage you to get the vaccine really at any point in time during infertility treatments. The only time where they would say maybe hold for a few days is if you're coming up on an IVF, embryo transfer, IVS kind of harvesting cycle. Just, you don't want those sometimes side effects of feeling kind of icky if you're having a procedure. But other than that, fully supported to go forward with it.
Okay, great. Some really next interesting questions. So, any effects on egg quality or embryo development, and would it be better to get vaccinated before or after an egg retrieval? So,
sure. I would say we're still learning. What I can tell you again is that these vaccines do not alter the DNA, and so theoretically, genetically, nothing should be altered in those embryos, which is great. Again, really the only guideline right now is to avoid it right around that time of transfer, and so it'd be up to the patient.
Excellent. I think this is a great question for couples having a baby. I plan to get the vaccine, this individual says. Should my husband get vaccinated before baby arrives?
Please, yes. Yes. Honestly, it's the same concept as when we give like the Tdap or the pertussis or whooping cough vaccine. We do what's called nesting around the baby. Sometimes infants can't get vaccines until they are so many months old, and so you kind of nest around them by protecting parents and grandparents and, child care providers. So yes.
Very good. Would you recommend the vaccine to someone in the high risk category during pregnancy?
Yes.
Yes.
Absolutely.
Very good. Another question. We've got some great questions
We have
coming
a
in
lot,
from
yes.
the audience tonight, so thank you all for participating. How do you feel about women receiving the vaccine who have had previous premature births?
I would encourage it as well. There is just a little bit of data that we're starting to look into about whether actually a COVID-19 infection is associated with preterm delivery, and so that's still very young, and I think we need some more information on that, but obviously anything that you could do to prevent a preterm delivery, again, would be favorable.
Mm-hmm. Very good. Are there any risks for a pregnant woman who is also on blood thinners?
No. I would recommend the vaccine for those patients as well.
Okay. Very good. Some really great questions tonight. We're waiting for one more. Are there any additional pieces of information that you're finding from some of your professional literature about the vaccine development, or whether a booster might be needed at some point in time? I think some of that is still being discussed out there, especially with the new strains of the vaccine that we're hearing about.
Yes. I think we're still learning. I think the goal right now is to get as many of the population vaccinated as possible. There are, some different strains that we're seeing, and any virus has the capability to kind of mutate and form, new strains and things. And so I think time will tell, if we need boosters, do we need, something else? But I would still encourage you to get it to at least have, partial coverage of those like mutations and new strains.
Very good. Does the vaccine affect my future on having children in the future?
No. Again, there was some media reports that the vaccines were associated with infertility, and obviously that's very concerning. I would be concerned if I was, doing something that would impact my ability to have children, but that has been completely disproven, and so no.
That's great news for women out there who want to get vaccinated and don't need to worry about that going forward. So that's great.
Yes.
We've got two more questions as we come up to the end of our time. So if needing RhoGAM during pregnancy due to being Rh negative, is there any contraindications with that?
It's a very good question, actually. No, you are allowed, or there's no problem with getting RhoGAM and the COVID vaccine at the same time. We usually delay the pertussis vaccine or try and time that vaccine a little bit around when a patient would get the COVID series, just to ensure that they are producing good immunity to both of them. But the RhoGAM is an exception to that, and you still get a response from that, and so there's no problem with that vaccine.
Okay, great. Do you know anyone that has given birth after receiving the vaccine to show positive outcome? I wonder if that might mean a positive COVID result or COVID test result. I'm not sure.
I know of my patients who have been vaccinated, and again, there's thousands of people on the VSafe registry now who have had the vaccine. They probably were vaccinated, in their third trimester, and they have delivered. I have not seen anything negative from that. We've had beautiful deliveries, beautiful moms, beautiful babies the whole time. And so hopefully that answers that question.
All right. If I had COVID already, should I only have one dose of the vaccine or both?
This is a great question. I would encourage you to complete the vaccination series. If it is a Moderna or a Pfizer vaccine, do both. If it's the Johnson & Johnson, do one. The COVID, an active COVID infection, you know, potentially provides some immunity for a few months. However, pregnancy is longer than that. You know, our lives are longer than that. And so I would still encourage you to get the vaccine even if you have had COVID in the past.
Would you, from a timing perspective, say get it anytime you can, or would you say wait those 90 days, which is kind of what we hear is kind of the natural immunity from having had the COVID virus?
I would say either or. You know, if you're recovered from the COVID virus, you can get the vaccine. It probably depends more on availability, you know, at this time, but I wouldn't probably go too much past that 90 days that we kind of see there.
Okay. And we have another question that asks about, will the vaccine affect milk supply while breastfeeding?
No.
No. Okay. Some really great questions this evening from our audience. Do you have any experiences in your office with you talked about you've delivered many beautiful babies already, so you're not able to give the vaccine in your office yet, are you?
Not yet. Hopefully someday, as it, you know, is more mass produced. I'm sure a lot of the Bryan offices honestly would love the opportunity to provide that to our patients. Most of my patients that I have seen have been kind of in those tiers that we're rolling out, you know, healthcare providers, first responders, teachers, most recently here. And I feel like every day I hear more people that, you know, we're vaccinated, and I see more people. So hopefully someday we can give it just like we give flu shots or, you know, anything else.
So right now, is anyone who is pregnant considered a high risk to be in a population allowing them to get the COVID vaccine, because most of them don't meet the age criteria?
Correct. Depends on who you would talk to, I would say. If you talk to somebody probably who sees pregnant women, you know, all of the time, we would tend to favor that, but not always. You know, our patients are young and healthy, and some of the other bigger governing societies who are kind of directing vaccines don't always include pregnant women in that, but I guess I'm probably a little biased with respect to that, but I think it's just so important that we reach this population.
Very good, thank you. Another question came in that says, I had COVID right before I got pregnant. I am now 17 weeks pregnant. The vaccine is available to me next week. When is it safe for me to get the vaccine?
I would say if you're offered, I would go for it right now. As long as you are fully recovered, you know, from the COVID virus, and if you feel comfortable, I think that's perfect time.
And my understanding is people are not able to choose the vaccine they get, so
yes.
you have an
Yes.
option to take or not take, but I think most providers are recommending take whichever, whenever, if you're going to get the vaccine.
Absolutely, absolutely. I have seen people who have had now all three, actually, with the Johnson & Johnson being rolled out recently.
Okay. Excellent, very good. My husband had COVID in December. Should we still receive the vaccine? And we are due in August.
Yes, well, congratulations. Yes, I would highly recommend. Yes, there's definitely been, you know, enough time lapsed, I would say, after that infection. You're approaching that kind of 90 days anyway, and so I think any time you could get vaccinated would be great.
Very good. The next question talks about how long after a miscarriage can I get the vaccine? Are there any timelines there?
Sure. Honestly, anytime you would feel comfortable. Again, if you are undergoing kind of a procedure for treatment, like a DNC for miscarriage, you probably would not want to time it right around that time, just recovering, you know, from surgery. But other than that, no restrictions there.
Okay, very good. We do have a couple of different vaccines that are out this season. We are just finishing up the flu season as well. So the next question says, do you recommend COVID vaccine and flu shot? And is there data from 2020?
Yes, I would say if you were offered both, I would definitely get both. I think, we've seen a little bit of an impact with the masking with the influenza cases, or quite a huge impact, honestly. Obviously, we're still, again, learning about COVID as this is a little bit fresh and the vaccines still just came out, but both of them would be great and fine during pregnancy or breastfeeding.
Very good. I would just add one point of clarification. As we've been doing our COVID-19 vaccine clinics here at Bryan, we are practicing some of the CDC recommendations where there needs to be a 2-week interval between the flu and the COVID vaccine, or the pneumovax or shingles. So you don't want to get them at the same time or really close together. We want that body's immune response to be able to trigger the vaccine at that time. So you can get them in the same season, but a couple weeks apart is recommended. So.
Yes.
Another question came in. It says, working in a clinic where I come in contact with COVID patients daily, I'm not vaccinated and due in July. Thoughts on this?
I 100% understand. I was there, before being vaccinated, and that was very scary for me. I think that, as well as reading the medical knowledge and things, I think that was probably the tipping point where I felt that I really, really wanted to get this vaccine while I was pregnant, just because you walk around so scared. Sometimes you don't know. You wear as much PPE and you wear everything that you can, but this virus is very scary. If you have the opportunity to get vaccinated, I would say, please do, especially since your exposure is so high.
Very good. Great. Thank you. Mm-hmm. Are vaccinated people still capable of passing COVID to those who aren't?
We're learning. We are learning. I think there's a thought that potentially you could, although I'll be honest, I don't know if I can fully, 100% guarantee that that's out of the question there. I think you still have to be careful. We'll probably know that answer, within this year or so after seeing more data on the vaccines, but I would still, encourage folks to wear the masks, wash your hands, use the Purell and everything all the time, and keep your distance from folks just in case.
Stay out of large crowds.
Yes.
And all of those
Yes.
things. So.
Yes.
Is there any contraindications to getting the vaccine if you're in a SNRI medication?
No problems.
No problems with that. Very good. Side effects. Are there any side effects of the COVID-19 vaccine?
Sure. Again, I think, most probably biggest side effect that I hear most commonly is a sore arm. I have heard that from a lot of patients. Some people get, within those first 24, 48 hours after the vaccine, a little bit achy, maybe a low grade, temperature elevation. For our pregnant patients, we just tell them to, monitor their temperature. If they feel like they're getting a little bit of a fever, to take Tylenol, as long as they're able to keep their temperature down with Tylenol, which most people are. Then after 24 hours, you feel okay, but you can feel a little bit icky sometimes.
Yeah, very good. So it looks like this concludes our live questions for tonight.
We have a couple more.
Oh, a couple more coming in. Okay. All right. Well, we'll get those couple more coming in. Have you had an opportunity to participate in any of the community vaccine clinics or any of those things? We've had such a great response from our healthcare providers in this community to vaccinate those folks who are stepping up to the plate.
Sure. I personally have not yet, but I think that's so awesome, everything that we are doing here. The fact, and honestly, that points towards our health system. This year and this last year, it was all about rallying together. I think we've been through something now that hopefully we never go through something like this again, but it shows how strong we can be when we all kind of come together, and really we're moving forward, and that's the important part.
We have a great collaboration with the health department and the other healthcare providers across the community, whether it's volunteering at Pinnacle Bank Arena for some of those clinics or the ones we have here at Bryan. So I have had an opportunity to participate in a couple of those. And my husband came along to help as well. So it was a great opportunity for him to do that. And it was just so so powerful and meaningful to see people so appreciative of the opportunity to get the vaccine. So I think that as you talked about being pregnant and trying to decide, and the fear that you experience in your work, and so many others are experiencing that same fear and are just really feeling a sense of hope once they are able to get that vaccine. So,
Absolutely.
Yeah.
Absolutely.
We've got another question that came in, and it is, any contraindications following a corneal ectopic pregnancy?
No, I would say, make sure if you had surgery for that or treatment for that, that you're on your way to healing. But after that, no problems with getting the COVID vaccine.
Very good. What are your recommendations for a nursing mother in regards to the vaccine?
Sure. So again, I would encourage all of the women that are breastfeeding, nursing, pumping, any of that to strongly consider. I would very much encourage them to get the vaccine. Again, we're still learning about how much immune response will be passed along, to infants, but if nothing else, the mom being protected is a huge protection for the baby.
What are the other benefits of nursing and breastfeeding? Why don't you
do a whole
talk about
conversation
that a
on
little
this?
bit? So,
Absolutely.
Yeah, because that's a really important message for our moms too.
Absolutely. Honestly, it is such a wonderful thing. I know here at Bryan, we pretty much immediately we do skin to skin right away. That helps with bonding. It helps with babies transition to, from coming out of the mom and breathing the air and being in this new world. Emotionally, huge, absolutely huge. But for little ones, as well, it's probably liquid gold. It is the best nutrition, that is out there for babies. Again, huge immune boost that they can get from that, from all of the antibodies from the breast milk. But I could, again, probably talk about breast milk and breastfeeding for a long time.
Well, it's a great information that everybody needs to be aware of as they're making that choice about breastfeeding or not.
Absolutely.
We've got another question. Is there any information out yet about patients who have been vaccinated and are breastfeeding? So anything in the research yet?
Sure. It's coming. It is very much coming. Again, we know from moms who have had the COVID infection that their antibodies do transfer to the breast milk. And so we're starting to gather data. The thought is as if an active infection in that immune response transfers to the breast milk, that antibodies that are produced by the woman's body with the vaccination would transfer as well, which would be great. I think it'll take a little bit more time to see some long-term, benefits from that and really determine the degree of immunity. But there's, it's heading in the right way. We just need a little bit more information there, a little bit more time to gather all of that. But it's positive.
Very good, thank you. How long does the vaccine protect you from getting COVID?
That's a good question. Very good question. Again, I think we are still learning. I honestly would have to see a bit more, data. We think at least several months, but it may be longer than that. I've heard kind of various numbers. But I think we would need a little bit more specific studies to be able to see for sure. So far, it seems like from those initial trials where the vaccine, was given to, non-pregnant patients, but in those initial trials, it showed a favorable response for months and months. And as time goes by, I think that we will see. So someday we may need a booster, but right now I think we just need to focus on getting that first vaccine to folks.
Very good. I agree. First shots first.
Yes, absolutely.
If you had COVID and were hospitalized, is it necessary to still receive the vaccination?
Yes. Obviously, nothing is necessary. We would never, force anybody to do that. But I would still recommend it. Again, we know that native immunity from the infection does not last forever. And so to avoid a future infection, I would say yes. Yes, I would highly recommend.
This next question, I think, is a great question. If the timing of the vaccines work, that one is given weeks prior to the delivery and the other after delivery, I'm assuming that this is not a concern or issue just as long as you get them both. Is this correct?
Yes, I would agree. Probably you would want to, in a perfect world, time the vaccines, maybe not quite on the day of delivery, just so in case, your arm is sore, you're not feeling quite 100%, you can still, enjoy the birth. But I have had patients who just with the timing of everything have had one and then they go back and they have the other, and there's no concern there and they do great.
What is the science saying as the efficacy or the percent protection after just the first vaccine? We know that Pfizer and Moderna both recommend 2, but there is some protection after the first one.
There is some, possibly 50% maybe around there after the first one, but again, if you can get up closer to 100, I would go back for that second one for sure.
Okay, great. We have another question. If the vaccine is available to the general public by the time we deliver, will the hospital give the vaccine to new moms?
That's a great question. I would love to see that happen. Very much love to see that happen. I know we offer many vaccines once women are postpartum. Hopefully someday. Someday that would be great.
I would agree. I think that would be great if we could do that. So, is it misinformation that the vaccine could cause infertility for you or the baby?
Yes, I would say that it is. Again, it's a very, very popular thing that I feel like patients are worried about. We had that thought circulating in the media, and there was a lot of publicity about that for a while. It has been proven not to be true, and so there's really no association with infertility with these vaccines.
Great. That's very comforting to know for
Yes.
women out there. Do the vaccines protect from the different COVID variants we're hearing about today?
Yes, preliminary thought is yes. There is some kind of cross coverage there, in the same way that the flu virus. There's many different variants of it, and you have some kind of cross immunity. We're learning as these certain variants come through. The vaccine is a little bit more effective against some than the other, but it's still better than no immunity at all.
Okay, great. Thank you very much. Well, it looks like that concludes our live questions, and we had some wonderful questions tonight.
Yes,
Thank you all very much for participating. We just really appreciate your engagement in this show, and we hope that it's been very helpful to you. As a reminder, if you have any additional questions about the COVID-19 vaccine, please visit bryanhealth.org/vaccine. This site provides information about all 3 vaccines, patient testimonials, and a wealth of accurate information. Dr. Bokemper, again, I would like to thank you for coming and spending time with us this evening. This is going to be a great resource for those women and families who are out there considering pregnancy or who are pregnant about the COVID-19 vaccine. There's an awful lot of questions out there, and you've answered so many of them for our audience tonight, so thank you very much.
Thank you for having me. Again, it's a huge honor to be here and be able to talk about something that is personally so near and dear to my heart. I would honestly encourage all women, whether whatever stage of their reproductive life they are, if they're pregnant with a baby, if they're trying for a baby, if they're thinking about having a baby, or they're breastfeeding, really talk with your doctor, get the true information, the true facts, and I would very much encourage you to strongly consider the COVID vaccines.
Good. Thank you. Great words of advice from an expert. So,
Thank you.
Well, that's a wrap on our Facebook Live series on the COVID-19 vaccine. On behalf of our entire team, I'd like to thank everyone for tuning in over the past month. It's been a pleasure to produce these episodes and answer your questions. Have a wonderful evening.